Hello, Diaz here, founder of Greenwood Dental. Welcome back. Today we're talking about trauma. We're going to discuss different types of trauma to the teeth and mouth and what to do about it. So it doesn't matter the cause of the trauma, whether it's sports induced, whether it's just social gathering induced, whether it's just an accident. Trauma to the mouth and the teeth needs to be taken seriously. So one of the first reaction of most of you is to go to the emergency room, which is a really good idea, to have a medical profession take a look, to rule out concussion, to rule out any broken bones, to rule out any muscle injuries. So that's the first thing. After that, typically the emergency doctor will refer you to your local dentist or your regular dentist. If you don't have one, again, they will send you to a local dentist. And that's when we get these cases into our office with such trauma. We'll reassess the parts of the face that were impacted by the injuries, and what we could do first, if the patient is comfortable, is to start to take X-rays of the teeth that were affected by the trauma. Some of you come in, if the trauma is real severe, it's very uncomfortable to bite on the X-ray, so we'll defer the X-ray into like a week or two, especially if the emergency room doctor puts you on antibiotics or some kind of a medication to bring the swelling down if the trauma is severe. So 2 weeks later, after that, we'll take X-rays and then evaluate the teeth that were affected by the trauma. Now, the follow-up for these teeth are very important. We try to take X-rays a month after, then 3 months after, 6 months after, just to make sure that the root is intact and make sure that the impact of the trauma on the root will not require a root canal, since sometimes the roots will die. But that's the way I practice, and I feel that preventative is very, very important to keep you guys posted as far as the progression of the healing of that particular tooth. Now, if you have broken a nose or you got stitches on your lips from a hockey puck, or playing football or being a cheerleader, being a base, and somebody fell on you, that kind of severe trauma, we don't recommend for you to come immediately right after the emergency room if you're being stitched and swollen, because it's really hard for us to see. So I would highly recommend just wait, give yourself about a week or two, take whatever medication they recommend for you to take, and then come back to us to reevaluate. Then we'll take the X-rays for these teeth. Now, the third type of trauma is basically if you knock the tooth out completely and the tooth is not broken, so it's basically intact with the root. Yes, drop it in a cup of milk or glass of milk and bring it over. Obviously, if there's no laceration, you can either go to the emergency room, or we can stitch you if somebody's available there, or call a local oral surgeon. These teeth are, for the most part, be able to place them back into the socket and hope for the best that the tooth does not die. But again, it will be the same follow-up. We'll implant the tooth back in, we'll take X-rays 2 weeks post-trauma, and then we'll take about a month post-trauma, and we'll follow up with the tooth and make sure the tooth's not dying, will not require a root canal. The future of these teeth, if they end up dying and if they end up with a root canal, you have to follow up and upgrade them and put a cap on them, because with the trauma, you never know how the tooth is going to age and the tooth is already compromised. But that's as far as do and don't with the trauma incident. I know probably you guys are not going to remember all this information if it happens, and I hope it does not happen, because you're basically, your mind and your body is in shock. So, but if you watch this video and you have, kids are running around the house, especially with the young ones, the toddlers are constantly bumping into things, at least we'll give you some kind of a guideline, what to expect, what to do, and what to avoid. I hope this helped. Be safe, be well. We love you, and I'll catch you on the next video. DS out.